Hey guys, welcome back to our fourth video on n8n automation for healthcare industry. So in this video, or maybe in the past few videos, we spoke about appointment reminders, billing reminders, filling up empty slots through waitlisting, and automated call agents to fill up slots. In this video today, the fourth one, we're going to talk about how to do accountable hospital discharges. So, in a nutshell, hospital discharges, not all of them kind of like goes back to somebody per se. So, there are situations where you will do hospital discharges in the form of outpatient clinics. You would also do discharges to the community, discharges to your local general practitioners. And of course, there are also these type of discharges that goes, you're healthy, go home. So this workflow really addresses more of those, you are healthy, but we give you a general practitioner referral for you to reach out to your general practitioner, or they call it GP, for further continuity of care. Right. And this often cites a little gap that we see in healthcare today, because there is this part of the missing bit, where the handshake that we talk about, where the hospital handshakes with you and you handshake with the GP. That is the problem. That is kind of like not really the problem, but a challenge today. So as mentioned, as a patient who walks out of the hospital, you hand them a GP referral letter, and of course you have no idea whether they have made that trip to the GP. And the worst part is, if they don't, their condition might worsen, and that actually leaves the hospital still accountable for that discharge, right? So, and the worst part is, maybe 2 weeks later, they end up back at your emergency department, sicker than ever, which leaves you with the word, that gap between discharge and follow-up, which is very expensive, very dangerous, but it is a fixable problem that we could use n8n workflow to kind of like address it and remove any or reduce any friction. Okay, so here's what actually happens when a patient gets a GP referral discharge. The hospital's job really is, at the end of the day, when they walk out through the door, the letter gets written as patients get handed, they got discharged out of the system. But what happens next is the patient has to be on their own to call their to call the GP to book an appointment, show up for that appointment, and follow through on whatever that's recommended in the hospital discharge letter. And if they don't, no one finds out until it's too late, which is kind of like that little care gap that we always say, you are in control of your health. But the problem is, yeah, sometimes having too much control is kind of a double-edged sword. So now, if you are thinking, isn't that the patient's responsibility? And technically, yes, it is. But here's the concept that changes everything in hospital management right now. It's called accountable hospital discharge. So the idea is very simple. The discharge isn't completed just because the patient left the hospital. The discharge is complete when patient is safely in the care of the next provider. But what if the handover fails, and that becomes, a tertiary hospital problem, any hospital's problem for that matter. And it is not really a patient problem, because it is a somewhat lapse of care, right? So this is where we are using n8n flow to really decide how it works. Okay, so this is where the trigger happens right here, that when the patient is discharged from the hospital, they actually get routed through a discharge type. And there is a risk stratification right here to say that is based on a certain risk factor of this patient, you want to decide how you want to handle this these patients. So for those patients who are healthy and well, maybe they won't be so strict in everything. But if so, for those kind of like healthy and well kind, perhaps maybe you don't need to use such a stringent workflow. For those maybe urgent care stuff, like the GP must hand over and handshake quickly, you probably want to notify the GP earlier. So you send an email to the GP right here, and then you wait for the GP to reply, right? And the GP confirms, then hooray, it's good, right? So then, of course, along the way, you will probably want some reminders to the GP. You maybe want to activate some AI call agents to the GP to say, by the way, I'm sending one patient your way. Do keep a lookout for this patient, right? So it's more of a two-part duty where the GP and the hospital kind of like needs to work hand in hand to make sure that everything is well, right? And of course, this is from the GP perspective, but from the patient perspective, you may want to also send them outreach to ask the patient, hey, recently you just discharged, right? So we realized that you are having a little higher risk score. Maybe you don't tell patients that, but in the form of a friendly message, talk about it and say, by the way, WhatsApp, SMS to the patient. Hopefully the patient replies you within 2 days. And if the patient says, yes, I reached out to my GP, you log that as confirmed and you are done, right? So then that is where this is something that we really want to log it to say patient has confirmed that they have finished the handshake, right? Of course, if the GP didn't confirm, there is a slack that you need to deploy. And of course, this is something that is very, very, very important right here, that the GP is well aware of their duties and roles and responsibility, right? So then, in a way, if you pull for the appointment status and the discharge is complete, then it's kind of done, right? You may want to also reach out to the patient over time. So remember we talked about healthy patients. You don't need such a quick 1 day reminder, maybe 3 days reminder. Wait 1 week and then deploy a Slack workflow to escalate after 1 week. So this more of application to the healthier set of patients out there. And of course, we also want to create a channel, right? Where when deterioration is detected, you may want to also have that channel where the patient informs you that their condition has deteriorated, and you can actually activate some sort of a workflow that can actually generate another like care coordinator or another repeat visit to the hospital, or even a teleconsult for that matter, or even a phone consult. A nurse or a care coordinator can just drop you a call to kind of like check on your condition. That really, really, really helps complete the whole patient experience to avoid further deterioration, right? And of course, we also check along the way for all these patients who self-discharge, which is high on high alert, that maybe you may not want, this type, you may want to keep a closer eye on patients who have kind of like self-discharge themselves, right? So in a way, this actually completes the handshake across the board for accountable hospital discharge, where you don't have to keep sending emails to your GP saying, I kind of like send you a patient, I kind of like send you a patient. This is automatically triggered when based on the risk score and based on when you trigger a discharge from the hospital, it will automatically generate the necessary information for the GP to be aware. It also reminds the patient of what she needs to do after hospital discharge. I think this is something very important, rather than having a care coordinator to do that calling of patient to make sure they keep up with the care plan that has been assigned to them. So yeah, this is a quick overview of the n8n workflow for accountable hospital discharge. Let me know in the comment section below on what comments or any enhancements to this workflow. And as always, my name is Dexter. If you like the n8n tutorial videos on healthcare, do give a like, share, and remember to subscribe to the channel. And I'll see you in the next one. Bye!